Ovarian cancer can be a silent killer because there's not been a test to detect it. Dr. Frank Cirasano joins us from Boca Raton Regional Hospital to discuss a new test that might be the real breakthrough in detecting this insidious cancer. Thank you so much for taking the time to discuss this with us today. Why is ovarian cancer so difficult to detect?
Well, ovarian cancer does not have identifiable early warning signs, symptoms, or a diagnostic test.
So what's this new test called?
The new test is called the OVA1 assay, which is a test designed to identify women with early ovarian cancer.
So, does everybody get this test when you have a routine gynecological physical?
Well, the test is indicated for women that have signs, symptoms, or a finding on an X-ray, such as a CAT scan or possibly an ultrasound.
How long has it been out?
The test has only been FDA approved for about 6 to 8 months.
So it's FDA approved, so it's no longer a study. This is available, and is it being widely used?
The test has not yet been, widely offered by most OBGYN offices. I think that it's just an initial evaluation to see how the test works out in the community.
Let's go back to exactly how it works, Dr. Cirasano. You said it's a blood test?
The OVA1 assay is a blood test that measures proteins in the blood that are shed by ovarian cancer cells.
Is there a certain age group that should ask their doctors about having this test?
Well, more important than the age group is the signs, symptoms, or findings on an exam. If a patient has a finding such as an ovarian cyst or a pelvic mass, then the test becomes important and indicated. What's
the accuracy of it?
The accuracy is actually quite good, significantly better than the prior assay, which was the CA-125. The CA-125 would miss about 50% of ovarian cancers. In the new OVA1 assay, the predictive value is much higher. It generally has a sensitivity of 90% to 98% in the postmenopausal female for identifying ovarian cancer.
And that's a real breakthrough, isn't it?
It's a very, very big improvement.
In fact, the other test, the 125, is not really even used that widely, is it?
Well, the CA-125 has been associated with a high false positive and false negative rate. It borders on the range of 50 to 60% accuracy.
Let's review again who should be checked and who should be talking to doctors about this.
Well, the important FDA criteria identify that any woman is a candidate for an OVA1 test, being 18 years of age or older, having a finding such as an ovarian cyst or a pelvic mass, and contemplating the role of surgery for resolution.
Who is at risk for ovarian cancer?
I think that's a very important question. Any woman with a prior family history of a GYN malignancy, being ovarian, breast, or uterine cancer, has a higher risk. Any woman with a personal history of breast cancer, or any woman with a hereditary cancer syndrome, such as a genetic history of a BRCA1 test.
Thanks so much for joining us and discussing this breakthrough in detecting ovarian cancer. Dr. Frank Cirasano is sponsored by Boca Raton Regional Hospital, which also underwrites our Ask the Doctor segment. We're back with more in just a moment.